More than a century ago, in the early 20th century, China was going through one of the most turbulent periods in its history. It was a time when two completely different medical traditions met face to face. Traditional Chinese medicine, TCM, with thousands of years of accumulated knowledge behind it, and Western medicine, which had only recently arrived in China. Their encounter was far more than a simple exchange of ideas. As Western medicine expanded rapidly, the largely apprentice-based world of Chinese medicine found itself under unprecedented pressure. Some even called for the abolition of TCM altogether, while critics dismissed it as outdated and unscientific. Many practitioners were anxious, uncertain about their future, and worried that their profession might disappear. Yet hidden within this crisis was an extraordinary opportunity. And that brings us to the remarkable figure at the center of today's story, the renowned Republican-era physician Zhang Zichun. What happens when an ancient medical tradition encounters modern science? Are Chinese and Western medicine fundamentally incompatible, locked in a winner-takes-all battle, or can they complement one another? To answer that question, we first need to understand just how different these two systems really are. Traditional Chinese medicine is built around the idea of balance. Its focus is the body as an integrated whole, emphasizing the smooth circulation of *chi*, the vital energy believed to sustain life, and the body's own ability to restore health. Western medicine, by contrast, approaches disease from a very different perspective. It seeks to identify specific pathological causes, bacteria, viruses, damaged organs, and eliminate or repair them through targeted intervention. The philosophical foundations could hardly be more different. Our story begins with this fundamental divide. We'll first look at how these two medical worlds collided, then meet a physician who re-examined ancient herbal remedies with fresh eyes, while also carefully evaluating the new Western drugs entering China. Most importantly, we'll explore the principle he proposed, a principle of synergy rather than opposition, and consider what it might still mean today. It was during this historic encounter that Zhang Zichun emerged as one of the most original thinkers of his generation. Where many physicians saw Western medicine as a threat, Zhang saw a once-in-a-lifetime opportunity. He was not the kind of doctor who simply memorized classical texts. He was intensely practical, endlessly curious, and determined to verify everything for himself. Whether the remedy came from Chinese or Western medicine made little difference to him. According to historical accounts, he even tested many medicines on himself to experience their effects firsthand. That kind of experimental spirit was exceptionally rare in China at the time. His first step was to turn a critical eye toward the medical tradition he knew best, Chinese herbal medicine itself. Rather than accepting ancient formulas unquestioningly, he examined each medicinal ingredient individually, studying how it actually worked. Take gypsum, for example, a common ingredient in Chinese medicine. Through repeated observation and experimentation, Zhang concluded that its fever-reducing effect depended heavily on both the dosage and the way it was processed. At the time, this was a remarkably modern insight, one rooted in experimentation rather than blind acceptance of tradition. His investigations didn't stop there. He also studied antelope horn, one of the most prized ingredients in traditional medicine. But instead of focusing on its prestige or rarity, he asked a more practical question. What therapeutic effects does it actually have? And if it works, could a more accessible substitute achieve similar results? For Zhang, what mattered was clinical effectiveness, not preserving expensive traditions for their own sake. One of his most famous observations perfectly captures his approach. Raw gypsum is as valuable as the finest elixir. Calcined gypsum can be as dangerous as poison. His point was profound. The key wasn't simply what medicine was used, but how it was prepared. The very same substance could produce dramatically different outcomes depending on its processing. That insight was far ahead of its time. So that was Zhang's attitude toward Chinese medicine. But what about the newly introduced Western drugs? Once again, he applied exactly the same standard. Judge them by evidence and clinical results, not by their origin. One medicine he studied was aspirin, already becoming widely known around the world. Interestingly, Zhang didn't simply accept Western pharmacology at face value. Instead, he tried to interpret aspirin through the theoretical framework of Chinese medicine. He classified it as having a cool nature and considered which categories of heat-related disorders it might best treat according to TCM theory. In other words, he wasn't rejecting Western medicine. He was trying to integrate it into his own conceptual framework. He also carefully examined quinine, then the leading treatment for malaria. He documented not only its effectiveness, but also its side effects, demonstrating that he wanted to understand Western medicine thoroughly rather than adopting it uncritically. After years of study, Zhang reached an important conclusion. He wrote an essay entitled on why Western medicines are not universally suitable for Chinese patients. His argument was straightforward. Western medicines could be remarkably powerful and fast-acting, but they were not universally applicable. Different patients had different constitutions, and treatment should never ignore those individual differences. In other words, Zhang recognized both the strengths and the limitations of Western medicine. So where did that leave physicians? If Chinese medicine and Western medicine each had their own advantages and their own shortcomings, what was the best path forward? This is where Zhang Zichun presented what would become the defining idea